introduce myself to you. My name is Siti Sholihatun Nikmah. On this occasion, I will discuss about case study 1, privacy. As a mark of duty, I will read the case study 1 before I answer the question in the article. Okay, let's go. Case study 1, privacy. Dr. D was an obstetric or gynecology resident pursuing a joint residency at the State University Medical Center and the regional hospital. During an invasive surgical procedure, Dr. D was accidentally cut by the attending physicians. The record does not indicate whether there was actual blood contact between Dr. D and the patient. It appears there was no blood exposure, although no one can be certain. The following day, Dr. D voluntarily submitted the blood testing for the HIV virus. The result confirmed that Dr. D was HIV positive after being informed of the result of the test result. Dr. D willingly withdrew from participating in future surgical procedure, informed the appropriate official of his condition, and request a voluntary leave of absence. Upon investigation, the medical center identified 279 patients who had been involved to some degree with Dr. D during the course of her medical treatment. Likewise, the hospital identified 168 patients who had been in contact with Dr. D since the time of his joint residency. Unfortunately, hospital records do not necessarily indicate at the time a patient is capped, nor do they specify the distinct role of each patient in a surgical procedure. Thus, as for every patient with a reasonable chance of exposure to Dr. D was included in the statistic outlined above. Both the medical center and the hospital filed petition alleging a compelling need to disclose information regarding Dr. D's condition to those patients potentially affected by contact with him. In addition, the hospital believed there was a compelling need to disclose Dr. D's name to the other 13 patients in the department, so that those patients could contact their patient in the event every had been assisted by Dr. D in any invasive procedure. In response, Dr. D asserted his right to privacy, arguing that no compelling need was tantamount to a justification to disclose his HIV-related information. The question is, should the hospital disclose Dr. D's disease? My answer is no. The hospital have no right to disclose Dr. D's names to the other treating patients in the department. Dr. D's right to privacy is not different from that of any other person. Therefore, disclosing Dr. D's name is a severe violation of his right to privacy. This extensive notification will discourage patients and other healthcare workers from treating HIV-infected patients. The right to privacy is an integral part of the inherent right of every human being to dignity. It represents the right of every individual to determine when and how much personal information will be exposed to the public. Every human being has a right to privacy, and thus, patients as well as practitioners are entitled to it. This right actually enables individuals to maintain their autonomy and to live as they want. Some countries ground this right in their laws, as stated in Article 9 of the Universal Declaration of Bioethics and Human Rights. The privacy of the person concerned and of the confidentiality of their personal information should be respected to the greatest extent possible. Such information should not be used or disclosed for purpose other than those for which it was collected or consent to, consistent with international law, in particular international human rights law. In addition to that, the record shows that Toyota has no blood exposure with patient, so it is still in the safe category, and Dr. D also has requested voluntary leave to recover. Remember, confidentiality is also important because humans have the right to be respected. One important way to show respect is to maintain their privacy. In medical settings, privacy is sometimes really compromised, but more because it is to safeguard personal life so as not to be too disturbed. Okay, this is my opinion, and thank you for watching me.